Today, we will talk about something simple yet powerful for our health. It's a small hand exercise that Japan's oldest doctor uses to help seniors reduce their stroke risk. You can do it in just a few seconds, even while sitting. This gentle practice improves circulation and calms the body at the first warning sign. Joining me now is Dr. Akio Matsumoto, one of Japan's most respected elder physicians. With over 50 years of experience caring for seniors, Dr. Matsumoto combines modern medicine with traditional wisdom to make health advice simple and comforting. Dr. Matsumoto, you once told me a story about one of your patients that highlights why this hand movement is so important. What happened?
Yes, Adams. I recall a 78-year-old woman who came to my clinic feeling a slight numbness in her fingers and a heaviness on one side of her face. The symptoms were so small, like whispers, but her body was already trying to warn her of danger.
Before we continue, we want to hear from you, listeners. Have you ever felt sudden numbness or tingling in your hands or face? Or has someone in your family experienced it? Share in the comments. We're all learning together. Dr. Matsumoto, let's go back to that patient. You mentioned her symptoms were very subtle, numb fingers and a heavy feeling in her face. What happened next, and how did this simple hand exercise come into play?
Many people think a stroke appears suddenly like a storm, Adams, but often the body whispers warnings first. In her case, the numbness in her fingers was not painful, just unusual, and that heaviness in her face came and went. When she came into my clinic, I asked her to try a small movement I have used for years with my older patients to gently improve circulation whenever they feel something is off. This movement is very gentle. You slowly open and close your hands with controlled breathing, like a gentle pump reminding sleepy vessels to wake up. As she practiced it, I watched her carefully. After a few breaths and movements, her face regained a bit of color, her shoulders relaxed, and most importantly, she seemed clearer and more alert. She later told me that during the exercise, she felt a strange calm wash over her, as if her body and mind were aligning.
That sounds incredible. So she felt better almost immediately?
Yes, Adams. By the time she finished, she was calmer and more aware. I told her to get tested right away. The scan showed a tiny blockage in her brain's blood flow. The doctors treated it, and she recovered fully. She was so thankful that we listened to those small signals in time. It could have been a very different outcome.
What a story. It really shows how paying attention to these subtle signals and acting on them can literally save lives.
Exactly. And I have seen other patients experience something similar. One man told me that after doing this movement, he felt warmth in his fingers and a surprising sense of relief. It gave him confidence in his body's ability to respond. It becomes a way to cooperate with the body in moments of doubt.
We should all remember, our bodies are constantly talking to us, even in tiny ways. Don't ignore it. And it's something you can do anytime, even if you're alone. No special tools needed, just your own hands and breath.
Exactly. I often teach this movement to healthy seniors too. It's like a gentle check in with the body. By practicing it daily, people notice if one hand or arm feels cooler, stiffer, or weaker. These subtle clues can prompt them to act sooner. In a way, it trains their awareness of small changes.
It's amazing how even just moving your hands can tune you in to your body's signals.
Yes. Now, I have a question for our listeners. Have you ever felt your hands go suddenly cold or numb without any clear reason? These small details can matter a lot. Please share your experience in the comments. Your story might help someone else recognize the same warning signs.
We'll explain how to do this hand movement step by step next. For now, let's continue. Now that we know why the movement helped that patient, let's dig deeper into the idea behind it. Some listeners might be curious, how can simply opening and closing your hands make a difference when stroke warning signs appear? Why would something so small have any effect at all?
The body is full of simple secrets, Adams. The hands are one of the body's most active gateways for circulation and energy. Our arms have many blood vessels that feed the brain. When we gently move our hands, especially with deep, calm breathing, we nudge the circulation in our arms and shoulders. It's like urging a slow river to move along when it starts to stagnate. For older adults who sit or lie down a lot, blood flow can become sluggish. The brain depends on a steady flow of blood. So, when a warning sign appears, even a tiny one, doing this gentle hand movement can help keep the blood flowing toward the brain. It's not a cure, but it can keep your system awake and responsive for a little longer.
That makes a lot of sense. I love your river analogy. Many of our listeners might remember times they felt lightheaded or their hands suddenly weak, and then it passed. Sometimes people shrug those moments off as nothing, but it sounds like ignoring them is risky, isn't it?
Exactly. Ignoring the body's whispers is like ignoring a knock on the door from someone with an important message. When the hands or arms lose feeling or strength, it's a sign that something inside needs attention. In my clinic, I often teach this movement to all my patients, even those who are healthy. It warms up the hands, keeps the blood vessels flexible, and most of all, it trains the mind to notice subtle signals. It teaches seniors to pay attention to how their hands feel. If one hand moves differently or feels odd, that could be a clue that something is wrong.
Awareness is such a critical part of staying healthy, especially as we get older. Many people might brush off a moment of dizziness or a tingle in their arm, thinking, oh, I'm just tired. But those could be whispers, not just sleepiness.
Yes. And now I want to ask our listeners, have you ever brushed off symptoms like brief numbness, dizziness, or a sudden strange feeling in your arm or face? Perhaps you thought it was just age or fatigue or something you could sleep off. If you feel comfortable, please share your experience in the comments. Many people feel alone when these things happen, but you might be surprised how common these moments are.
Your stories can help others learn to pay attention. None of us should ever feel embarrassed to speak up about our health. Even a small symptom can have a big message.
Yes, sharing helps others recognize when they should not ignore their body's signs. Now that we understand why this technique makes sense, we can move forward. Next, we will guide you step by step through the movement itself. It's simple enough that anyone can do it safely. Let's continue.
Dr. Matsumoto, our listeners are ready to try this technique. Let's walk them through it. Could you explain how to do it, step by step, just like you would teach your senior patients?
Certainly, Adams. First, I tell everyone to sit comfortably. Relax your shoulders and take a slow, deep breath in and out to settle your mind and body. Rest your hands in front of you at waist level, palms facing each other but not touching. Keep your hands relaxed, not clenched or tense. Now, let's start the movement. Gently open your fingers wide as if you're reaching towards something warm and welcoming. Spread your fingers apart and feel a stretch across your palms. Take your time. Open them fully. Hold for a moment if comfortable, then slowly close them. When closing, don't make a tight fist. Curl your fingers softly as if you're holding a delicate object that you do not want to crush. Your hands should move in a calm, steady rhythm. Do this open and close motion slowly, coordinating with your breath. I usually say, open as you inhale, close as you exhale. Breathe easily and let the movement follow your breathing. Each time you open, imagine inviting fresh energy. Each time you close, imagine gently pressing it upward. Repeat this cycle about 10 times or as many times as feels comfortable. You can even do this while seated or lying in bed if that's easier. Each opening and closing should be slow. Take a second or two for each movement, like a gentle, calming breath cycle.
I love how you said, holding a delicate object. It really emphasizes gentleness. Everyone listening, remember, move only as much as is comfortable. This is about awareness and flow, not strength. It should never hurt.
Exactly. Many seniors I work with do this every morning now. After just a few rounds, some of them notice warmth returning to their fingers and a gentle release in their hands and arms. They often tell me it helps them feel more awake and ready for the day. It's truly remarkable how such a small movement can bring a sense of calm and clarity.
And to all our listeners, if you're trying this now, pay attention to how it feels. Do your fingertips start to tingle or warm up? Maybe your wrist or forearm feels a gentle stretch. Those sensations mean it's working. You might also notice how tense your hands were before, which is part of the awareness this practice creates. You can also close your eyes during the exercise if it helps you focus on the feeling.
Yes, this is a supportive exercise. It's not a replacement for medical care. If you ever experience serious symptoms, you should still seek help immediately. But this technique is something you can do right away, anytime, to give your body a little extra support.
Now, we want to hear from you. As you try this movement, what do you feel? A warm glow in your palms? A gentle relaxation in your fingers or shoulders? Share your experience in the comments. Your observations might help others feel confident doing it.
Now that you know how to do the movement, in the next section, we'll talk about when to use it and which warning signs deserve your immediate attention. Let's continue.
Now that you know how to do the movement, let's talk about when to use it. It's easy to think mild symptoms are just getting older, but often they are important warnings. Dr. Matsumoto, what signs should really get someone's attention?
Adams, the body often whispers before it shouts. I always tell my patients to watch for these signs immediately. Sudden numbness or tingling in any limb, especially on one side. Sudden weakness or clumsiness in a hand or arm. Drooping or heaviness on one side of the face. Sudden slurred speech or difficulty finding words. Sudden confusion or trouble understanding simple things. And unexpected vision problems like blurriness, double vision, or partial loss of vision. Even a new, severe headache or intense dizziness can be a warning. Many people dismiss these as nothing, but they can be early signs of a stroke or other serious issue. When these symptoms appear, you must act right away. This hand exercise can help in the first moments, but it cannot replace professional care.
It can be so easy to write these signs off as something minor, like stress or just a bad night's sleep. But these signals should never be ignored.
Precisely. Even young and healthy people can have strokes, though it's rarer. If you experience any sudden change, even if it's just for a few seconds, treat it seriously. We often say, time is brain. Acting quickly can save brain cells. If you ever feel unsure, always choose safety and seek medical help.
I hear from so many people, I didn't want to be a bother. But your health is far too important to ignore these signals. Even if it turns out to be nothing, it's better to get checked than to risk waiting.
Exactly. Even if the symptoms pass quickly, don't ignore them. People often think it went away, so it must have been nothing. But even a brief episode can point to a bigger problem. If you ever doubt, listen to your instinct and get help.
We must look out for each other. Share this information with family and friends. It could save a life. If someone you know shows these signs, help them stay calm and do the exercise with them while they seek care. You never have to face these things alone. If you're unsure, ask a friend or family member to stay with you or help get care. Your loved ones would want to help.
Yes, remember, hearing about someone's experience can guide us. If you or someone you know has faced these symptoms, sharing that story might help others recognize danger.
Now, we want to hear from you. Have you ever experienced a moment like that? Perhaps your hand went weak, or you dropped something unexpectedly. Maybe you had a brief confusing spell, or an unusual headache. If so, share it in the comments. Your story could help someone else recognize their own warning signs. Next, We'll discuss how to make this hand exercise part of your daily routine and how often to use it. Let's continue. Dr. Matsumoto, we've covered how and why to use the movement. Now let's talk about making it a daily habit. Many of our listeners love simple routines. How often should seniors practice this hand exercise?
Adams, the beauty of this movement is its simplicity. It takes only a few seconds and can be done anywhere. I often tell my patients to make it a gentle morning ritual. Before you even get out of bed, sit up and place your hands on your lap. Take one deep breath and slowly open and close your hands 10 times as we practiced. This wakes up the circulation first thing in the morning and prepares the body for the day. Throughout the day, you can repeat it whenever you notice stiffness, cold fingers, or low energy. For example, you could do a quick round after making your morning tea, while waiting for food to cook, or during a TV commercial break. You can do it while on a phone call, or even while resting in a chair. It requires no equipment, just your hands and a few seconds. Many seniors tell me that after a week of doing this daily, their hands feel warmer and more flexible, and they become more aware of small changes in their body. It's not just exercise, it's also a mindful check in with yourself.
I really like that. It fits easily into our day. You can even do it in the kitchen, by your bed, or out on the porch. It's so quick and calming, and you don't need any gear.
Exactly. There is something deeper here. When you do this movement regularly, you develop a habit of noticing your body. You start to recognize if one side feels different from the other. For example, if it becomes harder to close one hand, that clue will catch your attention. It's both a physical and mindful practice. My patients often find that with this habit, they feel more connected to their health and gain a sense of peace from the routine.
That sounds wonderful. And to our listeners, we'd love to hear about your routines. Do you already have a simple morning habit to start your day? Maybe a light stretch, warm water, a short walk, or a morning prayer? Share it in the comments. Your routine might inspire someone else.
And remember, if you feel any numbness or heaviness while doing the movement, treat it as a warning sign. Practice gently, but if anything unusual happens, get help right away.
You really only need a few seconds. Some people do it twice a day, others whenever they feel a hint of stiffness. It's very flexible.
Yes, for example, some of my patients do this each time they brush their teeth or after they finish their daily walk. Others use a favorite song or radio jingle as a reminder. The idea is to make it as automatic as tying your shoes.
And if a family member needs encouragement, maybe do it together. It can be a small moment of care you share with someone you love. In our final section, we'll bring everything together and give you some simple homework and encouragement. Let's continue. We've covered something truly powerful today, and I want to leave you with one simple truth. Small movements can protect your health in big ways. This gentle hand exercise is easy, calming, and it gives you a chance to notice early signals your body might be sending. For seniors, especially those over 60, awareness of these little signals is one of your strongest tools.
Yes, Adams, the body always communicates if we listen. When you practice this movement each morning, even for just a few seconds, you learn to hear those messages more clearly. My homework for everyone listening is simple. Practice the hand exercise every day for 1 week. Do 10 slow openings and closings with calm breathing each morning. Pay attention to how your hands feel. This small daily habit can guide your health in surprising ways.
And before we finish, we want to hear from you. Tell us in the comments what you thought about today's episode. Did you try the movement while listening? Did you feel any warmth or relaxation in your hands? We truly read your messages, and they help us make better episodes for you. Remember, you're not alone on this journey. Take a moment each day to care for yourself with this simple exercise. Small steps each day lead to big improvements over time.
Even small steps can lead to big improvements. Share this video with friends or family who might benefit and know that we are here to support you on your wellness journey. If you enjoyed our conversation, we kindly invite you to subscribe to the channel for more calm, clear health guidance every week.
Take good care of yourselves, and we'll see you in the next episode.